So we've talked about COPD, and again, chronic obstructive pulmonary disease is a disease where you have obstruction of the small airways. Now, some patients with COPD, as they get older, can also develop obstruction of the large airways. We call that obstructive sleep apnea. And while we do our best to try to help people with their small airways with bronchodilators and COPD, if we're not treating the large airways, if there is obstructive sleep apnea there, we're actually doing them a disservice. It's been shown that people who have obstructive sleep apnea with COPD and are not treated for it, for instance with CPAP, have an increased exacerbation risk of going into the hospital. And when people with acute exacerbation of chronic bronchitis or COPD go into the hospital, there is a very significant 28-day mortality associated with that. All to say this is that if somebody has COPD and we really want to make sure that they're not ending up in the hospital because of COPD exacerbations, we should be cognizant, we should be looking for signs and symptoms of obstructive sleep apnea. What are those signs? People who have gained weight recently, people who have a very large neck, people who have snoring at night, people whose bed partners tell them that they stop breathing at night. All of these are signs and symptoms that the patient may have obstructive sleep apnea. Now, if they have obstructive sleep apnea, we should be testing them for that. People who don't require oxygen can have a regular home sleep test. There's other people that might need to go in for an actual sleep study, and this is one way of making the diagnosis of obstructive sleep apnea. If they do have it, it's important that we treat them for them, because studies have shown that people with COPD and obstructive sleep apnea that are treated with CPAP actually lower the incidence of acute exacerbations requiring hospitalization.